Hello, everybody. Welcome. We'll get started here in just a second or two. Let a couple more people log in. Looks like people are jumping in. You're in the right place. All right. Hi. Welcome to the HomeCare Roundtable. I'm Hannah Wolfson. I'm editor-in-chief of HomeCare Media and the host of this event. Thank you so much for joining us, and welcome to Reducing the Cost of Growing an HME Business. Today's event is sponsored by Tactical Back Office. Tactical Back Office offers a unique approach to HME provider staffing by training and connecting remote workers with U.S. HME providers to balance their staffing needs. Its employees learn in a functioning healthcare environment, and TBO trains them in real time with real situations. Visit tacticalbackoffice.com. Today, we're going to look at the current HME landscape and some ways to reduce costs as you scale your organization. And you'll have plenty of opportunities to ask questions of our experts. So let me take a minute to introduce them now. First, we've got Todd Usher. Hi, Todd.
Hi.
Todd is founder and CEO of Tactical Back Office. As an entrepreneurial visionary, he has a keen ability to identify underdeveloped opportunities in the healthcare and HME industry. He brings a wealth of industry-specific knowledge and a proven track record of applying innovative solutions to complex challenges. He thrives on interaction with customers and staff, channeling his energy into delivering measurable results for all stakeholders, ensuring that every strategy is not just visionary, but grounded and practical. Thanks for joining us, Todd.
Thank you.
We've got Corey Smith. Hi, Corey.
Thanks for having me.
Corey is Director of Sales for TBO, a customer-first sales professional with more than 20 years of experience in the HME DME industry. Corey brings deep industry insight and a proven track record in delivering solutions to drive operational efficiency. He is currently serving as the client sales executive, overseeing operations across the US and Canada, helping healthcare businesses stay fully staffed. Thanks for coming.
Thank you.
And then we've got John Wright, last but not least. Hi, John.
Hello, Hannah. How are you?
Good. John is Executive Vice President of Sales Management and Business Development for ShopWriter. John began his career in the healthcare industry in 1976, joining a multi-branch independent provider specializing in home care, respiratory, and rehabilitation services. He was recruited by Invacare Corporation to manage a key sales territory and stayed there for 27 years, leading in the role of Area Vice President. He founded Riker & Associates, a firm specializing in sales management, business development, and the commercialization of new products and programs within the healthcare and medical equipment sectors. So thanks to our great panelists for joining us. We're going to go ahead and get the conversation started. This roundtable is designed to give you an opportunity as attendees to ask your questions. So be sure to submit them at any time during the presentation using the Q&A feature on your screen, and we'll try to get to them as we go. If you don't see the Q&A feature, it should be highlighted at the moment. You might have to move some of the blocks around on your screen in case it's hidden, but it shouldn't be too hard to find. So let's go ahead and get started. I think we're going to start off asking Todd a little bit, since he started out in the HME business and currently works with a number of providers. Why don't you talk to us a little bit about what you've called the new normal in terms of what it takes to run an HME business today?
Thank you, Anna. I think the new normal for us started in 2016 when we were hit twice with not only the rural rollout, which reduced our reimbursement by about 60%, but the minimum wage hikes that were happening that same year. They announced where we were going from $9 an hour to $15 an hour, marching about $1 a year through the year 2020. And we really couldn't take both at one time. We had to figure out what we wanted to do, because we can either close our doors or figure out how to lower our costs, and labor was our biggest cost. So we had a connection, a mutual connection in the Philippines, and we opened up a call center and hired our first person at that point. The competitive bid rural rollout was probably one of many, not probably, it was one of many cuts since 1997, when they reduced oxygen reimbursement by 30%. And then in 2003, 2005, 2008, you had the pay for the delay in competitive bidding itself. And they keep on cutting right through early last year, where they eliminated the 75-25 blended rate. And we're not alone in healthcare. Physicians for the last 4 years have gone through cuts themselves, and they're having a hard time finding physicians as a result. But when this happened, the people who didn't change went out of business or closed their stores altogether. There was about a 45% reduction in HME providers nationwide, according to AA HomeCare. So this was serious enough to where it caused a lot of companies to just fold up and be done with it. But we wanted to survive, and this was our way of surviving. During that time, we had to deal with the new normal of employment and hiring, and the expectations that were out there. The minimum wage hikes rose the whole sea level of expectation of what people thought of themselves or were self-worth. So it was very hard to find anybody at that time. So we transitioned during the next coming years, 16, 17, and 18, reducing our headcount from 45 down to 5 and replacing those with TBO folks. And that's how we were able to survive. So it's just not the government forces that are against us, but it's the overall mentality of the workforce that is actively working against what we're trying to do as business owners.
Yeah, for sure. John, can you talk about this a little bit, how it's played out for you, either at ShopWriter or in the past? What kind of hurdles have you all had to overcome, and how much of a role has staffing played in that?
Well, we got to a point where we were trying to recruit people. We had some people that left the company for various reasons, moving or something. But, so we went to temp agencies, would hire people, bring them in, try to train them. We put about a two months worth of training in as we're paying this temp agency, only to find out that the people didn't want to do the job and would leave soon thereafter. So we were extremely frustrated for a number of years going through this cycle of hiring people and having them quit very soon. Someone has to train them. I mean, that takes another person or at least one other person to train that person, which puts them out of their particular position. So it became very, very frustrating. I've known Todd for a number of years, and he called me about this new venture that he was starting, this TBO. And we talked about it for a while. And he and I both worked for Invacare at one point in time, where some of the people there thought it was a good idea to try to outsource to India. There was a lot of problems with that. It was, a huge time zone situation there, number one. Number two, the people that were there were not necessarily educated. A lot of them spoke broken English, to say the least. And people, our customers got very, very frustrated with that. And they wanted somebody they could talk to and understand. So we were very reluctant at first, to be honest with you. But then after talking to Todd and having a couple of conference calls with the upper management at ShopWriter, we asked a lot of questions, and a whole lot of things came to light. Number one, I didn't realize this, but people in the Philippines are taught English throughout their career in school. So their English is virtually impeccable. Their work ethic is incredible because, of course, this is a nice job for them to be able to work out of their homes, be able to, get a good salary and, make a decent living, which is a little bit tough for other industries over in the Philippines. So when we initiated this, basically we tried it. We tried, I believe it was just one person, Todd, maybe I'm wrong with that. Yep. But in any event, that person came to us already, let's just say pre-educated in the program. And so Todd would bring people in, he'd train them, give them basic customer service skills, training, how to use the equipment, all that type of thing. And then he would give us 3 people to interview. So we could find out a little bit about those people, talk to them a little bit, find out about their, willingness to want to, come to work for a company that, was across the ocean. And then we would pick somebody, and I would wind up actually doing some of the training on the equipment and pricing programs and so forth. So the first couple of people that we hired were in customer service. Now that worked out real well. We did have a little bit of turnover at the very beginning, but the nice thing about Todd and TBO is that they always had people in the wings just waiting to fill a position should something open up. So the things that we were thinking about that might turn out to be a problem turned out to be incredibly minimal. And we've been with them now for about 4.5 years. We have currently on staff, we have 6 people in various capacities: customer service, tech support, credit department, collections, those kinds of positions. And these people they work hard, they're very thorough, and they're a complement to what we do. The one thing that we do that I think really helped, we have weekly meetings every Monday morning to kind of calibrate people for anything that might be going on, new prices or new products or inventory, that type of thing. So these people are actually part of our personnel. They participate every Monday, and they're part of the team. So
that's great.
Anyway, it's been a nice 4.5 years so far. Again, started out a little bit rocky, but it was able to be overcome. So
that's great. And I want to come back. That's fantastic. I want to come back later and talk a little bit more about some of those lessons about managing remote employees, whether they're overseas or not, for sure. But before we jump to that, and maybe I'll throw this one to Corey since I haven't picked on you yet. It sounds like just in general, as home care and HME companies grow, managing gets more and more complex. What are, I guess, some of the practical ways that you can run lean without, hurting service or hurting whatever the end result is?
Sure, absolutely. And the way I'll tackle that, Hannah, is by emphasizing that we want our clients to understand that these individuals have been with us for up to 16 weeks, and we've trained them and vetted them and screened them, which is by far more than what similar models I think do. But once they're onboarded, treat them just like they're another staff member. And what I mean by that is build in redundancies to limit the burnout your local staff have. Think of it as a complement to what you're already doing. If your staff is backed up in denials today, well, guess what? They can help with denials. They can, there was another webinar I watched recently where they talked about, by default, there's about 10% denial rate with like Medicare Advantage plan. They're just going to deny no matter what. So you use staff to help with that, or cross-train them. So if someone goes on PTO. So managing them should be no different than managing your local staff. Should be treating them the same way. And they're professional people. Most of them are college educated. So I think some of the misconceptions out there are, that they're going to come in, they're not going to have any experience or training, or they're not going to work out well based on maybe some experiences they might have had calling, a large corporation that might be using offshore staff. So everyone has those misconceptions, but these people are educated. They want to work, they're professional, and just treat them like any other staff member.
And they're specifically trained in doing this type of work, it sounds like.
Yes, not just classroom training. They actually do get, I want to emphasize that as well. We've worked really hard to get them firsthand experience in a live DME and sleep environment. So they're actually touching patients, virtually, calling patients, interacting with patients, whether it's in Brightree or Nico Health or other EMR applications, Somnoware, just to name a few. So they will come in day one knowing what those things are, knowing what HIPAA is, knowing how Medicare and private insurances differ, which makes them about, when they start with you, about 80% trained, so that you're starting off day one with them pretty much knowing everything they need to do for the most part, and you're just acquainting them with your nuances of your business.
That's great. And this could go to anybody. Talk about, I think John touched on it a little bit, but some of the roles that you've had people fill. You want to grab that one, Todd?
Oh, Todd, sorry.
Yeah. Or anyone. Yeah.
Hello. No, it's with intake, you've got customer service, order processing, data entry, hospice portals, such as DME Track or Forbin. Billing, you've got government or private contract aging, hospital discharges, posting, QA, PAR, CMN, administrative, like compliance, HR, UMR, bookkeepers, working resupply operators. I mean, the list goes on. And some of the ideas our clients have given us that we never even thought of was dispatchers. We had a request to prepare some dispatchers, so we had that. Or nursing. We have a virtual lab out of the East Coast that needed some nurses to work some follow-up calls. Respiratory therapists, sleep technicians, actual RPSGT certified sleep technicians, or respiratory therapists. So the list goes on. And I think recently we've had a lot of power mobility and rehab, knowing that we have an expertise in that, we can train in that. We had some folks that had won the competitive bid years ago. We supplied some intake people for them. So there's a lot of positions. It's basically every position you can think of, and we've lived this. Every position you could think of, with the exception of the technician driver going out to the patient's home, you can fulfill with the TBO personnel.
And
go ahead.
Oh, sorry, Hannah. Just to piggyback what Todd's saying, I mean, there are a lot of good services out there. There are a number of services to choose as a DME owner or a healthcare company, and a lot of them are really good. But some of the things that they do for businesses still require an additional person to touch the order, or do some sort of data entry, or do some sort of redundant work on the back end, and that's where TBO personnel can help complement what you're doing today. So regardless if they need to have a replacement person today or not, if you're using a service, consider bringing on a TBO to help with some of that redundant work that they thrive at doing as well.
That's great. I think one thing we talked about setting up this webinar, we talked about how it could also help not just in managing your day-to-day, but in growth. How can using this kind of service or staffing help in terms of companies who are trying to maybe scale up and maybe aren't ready to make a jump to a whole bunch of new hires?
So we expanded our HME DME company a couple years ago, and we added some TBO personnel to handle the intake, and the order processing, and the billing. And all we had to do locally is hire technicians and drivers to go out and deliver the equipment. And that is basically a virtual warehouse, if you will. Also in 2017, we opened up another business, a sleep lab. And that sleep lab, all the intake, all the billing, scheduling, rescheduling, work of the denials, and all the things that go along with that, again, it's handled by TBO. We have one live person that handles the HSTs if people come into the office to get HST units. And then the actual techs, we have a couple of techs that work the night shift, but then they're supported by RPSGT or sleep techs in the Philippines. So TBO provides those folks as well to support them, to increase either their capacity or to handle the scoring, or to do whatever needs to be done to support that growth of handling a 6-bed lab. So there's a lot of opportunities there for TBO to promote that growth without having to promote the infrastructure that goes along with it, especially local personnel that comes with a whole host of problems.
So when I started working for Todd, we worked really hard from day one on building a consistent infrastructure in our training program to be ready to deliver when clients need people. And what I mean by that is clients sometimes would come to us with a curveball or a unique request or something maybe a little more complicated, and it might have taken us a while to get that individual ready for a client. But we can consistently say now that whenever a client needs a new position, within 2 weeks, we can have interviews ready and they can be ready to onboard, which helps tremendously with scaling of their business. And then on the flip side of that, if something happens where an individual needs to take maternity leave or paternity leave, we're talking days where we can have another individual, not weeks. So that helps complement what Todd was saying with regard to scaling your business. We have people wanting to work, ready to work, and they can be ready in as little as 2 weeks.
And that was important to us as a business owner because we got to see firsthand the needs of what our customers are going to want. They're not going to want to wait. Customers used to wait a month and a half, a couple of years ago, and that was just not sustainable. So we changed that. to respond to customer needs because we had the same need internally for what we were doing. So owning that HME DME business allows us some insight as to what the needs are of our clients and to prepare our TBO team accordingly.
That's fantastic. Somebody's asked a question here from the audience about, I think you mentioned HIPAA briefly. Are there issues with remote employees who are not in the United States logging into health insurance portals to check patient information?
There have been no issues that we've seen. There's been a couple speed bumps that we have to overcome, but we've been doing this for better part of 10 years. A lot of the payers are already in the Philippines. A lot of our national competitors are already in the Philippines. So we have our security measures and the what we've deployed as far as our IT is concerned. We contract with 2 IT companies to make sure our bases are covered, and each one with a special expertise. And there's been no issues to speak of. In fact, the 1 or 2 breaches that have been experienced, it was the client that had the breach. And we had to bring it to their attention, and we were able to catch it for them. So it's a non-issue. We think we've got our bases covered.
Yep.
That's great.
Yep, and we've also been able to partner with some health systems as well that use Epic and some more complex, questionnaires and security parameters, and it's been a non-issue for them. It just comes down to the fact that for some people this is a different business model, and we respect that, and we can talk through any concerns individually, and we'd be happy to do that if anyone would like to set up a meeting with us.
And in light of that, we follow their protocol. So if they have specific needs or wants according to their policy and procedures, we'll follow their lead. We're not going to tell them what they need. We're just going to follow what they've requested from us. Some things we've had to put in place to accommodate that, and we're willing to do that.
That's great. Talk a little bit about, and maybe John can start a little bit elaborating on his own experience, but talk a little bit about looking at kind of the cost and performance factors. What kind of things I know you'd been through a bad experience first, so what kind of things were you weighing when you made that decision?
Well, the first thing was that the upper management, quite frankly, was not paying attention to the KPIs like they should have. And, it's kind of a hard conversation I have with them, but how are they going to know if they're going to be able to improve DSOs and things like that unless they're monitoring it? So we were able to do that. And we, like I said, we put a couple people in the credit and collections and so forth so we could improve that. And we saw incremental business month after month after month. So it really helped our cash flow. And then, of course, there was other things too, like, people on the customer service lines answering questions, maybe even initiating a new account to join with us, those kinds of things. So, we started monitoring that, and we saw improvements all the way along the line. I think our biggest thing, though, of course, was the cash issue. And like I said, we put a person in collections and another one in, our credit department that would set up accounts and make sure that we had things squared away for them. We use a insurance company to insure all of our receivables, which is very helpful too. And so we would, basically take that application, turn it over to that insurance company. They would, come back with a yes or no, or, issue a credit line or whatever the case may be, so we could add it to that insurance policy. So there's a lot of things that we've been able to do to improve, and it's all been very, very positive.
That's great. To that end, I'm going to go ahead and shoot out this first poll question to the audience, which is going to ask about, and give you all a minute or so to fill it. It's going to ask a little bit about sort of how much time you or your organization spends on some of the routine tasks. I think that we've maybe already mentioned a little bit, but I'll be curious to see. I'll give that just a minute to go through. But I guess while they fill that out, Corey, what do you think are the things that maybe keep people away from making this kind of decision?
So, yeah, it's a good question, and there's a number of answers to give, but I think underlying a lot of times it's just misconception about either what we do as a company or how well this would potentially work for them based on previous experiences. What I can tell you is Todd had the vision a long time ago, before it was cool to work from home, to understand why models like this didn't work. And let me tell you, there's a reason why some of these models don't work, and it is the commute times for some of these workers to have to go and commute 3 or 4 hours a day to a building, sit in the cubicle. The turnover's high, and so sometimes people have misconceptions about a remote worker and how long is it going to work out? Is it going to be a short-term thing? How well am I going to manage them? So in addition to setting them up with the home office, we decided, Todd made that decision to say, let's invest up to 16 weeks of training. So another misconception is that when these people come in, how well are they going to speak English? Because I'll call, Verizon, or I'll call some other large company to get tech support, and it's hard to understand the people. Who knows where they're working? Who knows how that company, hired them or prepared them? With TBO, these people have all been rigorously tested and trained and screened and vetted for up to 16 weeks, and clients interview them, vet them. You're going to treat them like your own individual or staff member. And if there's any shadow of concern or doubt, just let us know. And so some of the misconception is, I think, that they're not going to get to meet the people first, or they don't know how well it's going to work out based on their own previous experiences.
Gotcha. All right, I'm going to jump in here and share this slide, or share this poll. And here's what we've got. It looks like for how much time do you spend on routine admin tasks? About 14% say less than 5 hours a week. About 43% say 5 to 10. You're nodding your head. About 28% say 10 to 20. And about 14% say more than 20. So it looks like the bulk of people sort of in the middle are spending, 5 to 20 hours a week on these kind of documentation, emails, things like that. How much of that does that really slow down your business then, to have somebody full-time in-house working on those things?
Yeah, and absolutely, and sitting on hold with the insurance payers, if for insurance verification and all those other things that take up time, it's great to use a TBO resource to do some of those things.
Yeah. Todd, what do you think some of the actual savings might be that people, or what do you see some of those savings being that people can realize with remote staffing, either time savings or monetary?
So some of the savings that we realized was immediate, and that was pretty substantial. I mean, we don't have to pay for desks, computers, heating and air conditioning, personnel management. It was a lot easier to deal with that. Workman's comp insurance, you don't have to pay for that when you're hiring somebody out of the country to fill these roles. Those are immediate savings, by the way. So look at the rise. I mentioned minimum wage increases over the last 10 years. That's raised, the whole C-level is raised as a result of that, to where we're paying people that we never expected to so quickly. So that savings is immediate. And let me give you an example of that. If I buy a operating system or program, or even AI out there, and it says, it's going to reduce redundancies, it's going to make this happen, you're not going to have to devote personnel to this, and you're going to realize that savings, but it's going to be months, sometimes even years before you fully realize that savings. Whereas if you're paying somebody $20 an hour plus 33% for their benefits and PTO, it's $30 an hour, and they quit, and you replace them with a TBO, that is a 66% savings immediately on your next payroll run. So you get to see that savings quickly, and it's dramatic. It's more so than anything else out there. As you know, labor is the biggest cost of our business. And if I'm replacing them with TBO folks and the local folks are leaving, that you see that immediately. You see that the next pay run. And that's just huge. And then all the infrastructure savings that go along with that. And it's a long list that you get to save as a result of making that choice.
That's fantastic. John, for you all, was it mostly replacing people as they left? with TBO employees, or were you finding that turnover was really high and this was an easy way to fix that?
Well, finding, yeah, with the turnover situation that we had two people that left almost simultaneously. And so that was one was the manager of customer service, and the other one was a customer service person. And so we needed somebody right away, as I just mentioned. But the thing was that when I talked to Todd about that, he had 3 people in the wings that we could interview right away and see about putting them to work with through TBO. We did have a person that we promoted inside that was more of an operations manager, but he became a customer service manager too. So, that worked out real well because he was with the company for a number of years and knew it inside and out. So when those other people came on board, that problem instantly went away. And of course, in the process, we were able to have some savings with it, able to hire some additional people because our business was growing. So the outcomes have always been on the upside, with this program.
That's great. This is before we go any further on that, I want to sort of stick with that topic for a second, because right as I asked that, somebody from the audience sent a question in on the same topic, is how do you, what do you see HME companies doing with their current staff members as you transition to offshore employees? We've looked at repurposing them for revenue generating jobs, but are interested to see what types of jobs others are doing versus eliminating their position, or any recommendations that you may have. And John just mentioned the opportunity to promote somebody, and presumably since you're saving costs on some of your other staff, that gives you a little bit more room to give them a bump as well.
Mm-hmm.
But have you seen other things that people have done creatively out there? Corey, you were nodding.
Well, yeah, I mean, I'm waiting for Todd to maybe tell some of his experiences, but what I'll tell you is I don't want anyone to think that this is meant to have you fire your existing staff. It's meant to complement what you're already doing, and what our experience has been is you have those core people that do want to work, that are showing up, they're following your processes and procedures, they're doing a good job, they're following your KPIs, and they're good employees. But for those that have people that they get trained and they quit 2 months in, or they have maybe unrealistic expectations about what they should be paid or how they should be treated, or PTO policies or whatever it might be. This is a model where it's afforded companies the ability to have that good core group, and like John said, maybe promote someone or let them focus on things that are really good to do for in-office staff, or being able to greet patients as they walk in, things like that physically, and utilize this model to do things that are maybe a little bit more tedious and redundant, more entry-level type work, if you will, and complement what their good staff members are doing. So they don't have to spend all this time training and retraining and posting on Indeed and spending all that time that just sucks the life out of you. Let us handle that, and that's what we excel at.
And that's what we did, Hannah. When we started this in 2016, we just replaced people through attrition. As they were left out the back door, a TBO came in the front door. We didn't have to cut anybody. And we had a 45-person call center, and 40 people eventually left in that 2-year period. 5 of them that were there that survived this are still with us today. And now they're supervisors, managers, and very well versed on our systems and our policies. And they're great to work with. And we didn't want to get rid of those folks because they were key players. But the other folks didn't value our work as much, and they left, and we replaced them with TBOs. So we didn't have to cut anybody, and I think that's a big point to what Corey just said when he's talking to customers. We just started with the 1 or 2 people that was a constant revolving door, and addressed it through TBO. But eventually, when people left, we just made the decision that we're going to replace them with TBO folks and not replace them with local folks.
This is a little bit of a leap maybe, but I just had a conversation this morning with a mobility provider that has a real internal push toward people getting their ATP if they want to, or becoming ATPs. And so I can see it being a kind of situation where you could, have somebody to sort of pick up the load a little bit to free up the time in the day, the week. So the person who's getting some kind of continuing education, growing their credentials, can take the time out of their daily work to do that and kind of grow into a leadership position. So that might be something that you could do.
Absolutely.
So yeah, and as Todd mentioned earlier, we have got a lot of CRT and complex rehab clients, if you will, and some of the requests we've got is for case management to assist. Maybe it's a nurse or a nurse trained individual that we have, or someone with some nursing experience, and those individuals can be prepared and prepared for those types of roles. So as I learned early on from Todd, if you're not sure if we can do it, challenge us. And if it can be done remotely, let us have that opportunity. And yeah, to your point, Hannah, give your staff that do want to work the ability to do things like that.
That's great. We've got a member of the audience who's asking, this is speaking of nursing, does TBO work with other community-based care agencies beyond DME? You do some home health work, right?
Oh,
Talk
yes.
a little bit about that.
We have home health. We have a couple startups, a couple in the Silicon Valley. We have manufacturing, such as ShopWriter. We have labs, a couple online labs, in fact. So and we've moved into the physician space, chiropractors, dental. Who else, Corey? There's a couple other ones out there that we've moved into that have seen what we've been doing and have decided to move forward with a TBO.
Yep. Yeah, and it just comes down to a lot of the needs are very similar, right? And if it's healthcare and the individuals already know about HIPAA, and if it's kind of whether it's reception type work or logistical work or work that can be done remotely, there's a good chance that we can find an individual to do that work for you. Scribing, being logistical planning so that home health nurses aren't going, you don't have the same nurse showing up, the same patient, and doing things like that. So there's a lot of different things that we can do. And yes,
we've had requests for complex scheduling, and complex scheduling is what we've realized in our sleep lab, because people cancel or they have last minute schedule changes. And so our TBO team is immediately on the phone, getting people and keeping those beds filled and the census full. And that's been helpful to us because now we don't have a lot of beds in our input.
Yep. Oops. Sorry about the feedback there. We'll take another second. I've got a second poll here to shoot out there. Let me go ahead and push that. And you'll see that in a second. How often do you find yourself managing employee performance issues, which can be encouraging staff, disciplining staff, or replacing staff? We talked a little bit about that already, but I guess, there's sort of, it seems like there's kind of two aspects of this. There's the financial aspect, and then this sort of time aspect of having to constantly being onboarding, training, retaining, and kind of managing staff. So how much of a role does that kind of everyday grind play as opposed to just the bottom line?
Well,
I'll let anybody jump at that.
Yeah, for us, we get a lot of that out of the way, and you figure the client has their eyes on them. We have our local supervisors that can assist in training or disciplining or keeping an eye on them, productivity. So we're not going to do that full time because we're handing them off to the client at that point. But we have productivity software we can deploy as well. And then obviously we encourage you to use your operating system and what that may offer, like any dashboards or scorecards that you have to monitor productivity, like error rate or DSO or whatever that case may be. But there's still staff members, they still need to be managed. And when we place them, we want to put them in a position for success, but it's still up to the client to make sure that that person's going to be a good fit and to be productive and manage their duties well. And that's what we want to ensure.
And I think this is where we maybe get into the overlap between, what TBO offers and just this new world of remote work that we've entered into. I think a lot of companies, even if they have their folks who are in town but not in the office or sort of struggling with what kind of metrics should people be looking at in terms of making sure that people are fulfilling their job requirements. You mentioned productivity software. Is that something that you generally recommend? And how do you kind of build a company culture that keeps remote employees engaged? Corey, you want to jump on that first? And I might have everybody answer that, because I know you all have different experiences with it.
Yeah, John will have some good things to mention. That he mentioned that he does a weekly meeting with this whole team, you know, and makes them all feel like they're part of the team. So that's what I again recommend, is just, you know, if you're not already managing people remotely, I mean, I think everyone did have some experience during COVID with that, right? But if you're not doing it now, and especially if you are, just consider it as if the individuals are working remote in your area. Just treat them the same way. Hold them to the same expectations. You know, hold the metrics that you hold to your current staff, or order processing rates, or calls, or how whatever the metric is. Hold them to those same expectations. If those expectations aren't being met, we can have a conversation. We can follow your lead. If you know, we may be misplaced, him or her, in that position, or maybe she or he didn't understand, you know, the guidance from whoever the manager is that they were assigned to. So there's a number of things that could be done, but for the most part, it's a very positive experience. These people want to work, and they're very task driven, as long as they have clear direction from the clients on what the expectations are. And yeah, I'll leave it at that. And, you know, like I said, John, I'm sure will have some things to share about what he does for his staff members.
Yeah, I'll let you jump in, John.
Okay, well, pretty much what Corey just said here. You know, we realized early on that these people were remote. They didn't feel like they were attached to the company, you know, directly. And so we started having these weekly conversations, and it's just expanded. In other words, it started out just being a weekly call about inventory. As we were going through COVID, you know, there was a lot of supply side issues that we had to deal with. And of course, our customers, you know, they were not able to order product consistently and get it from a lot of manufacturers. We picked up a lot of business because we were able to keep containers on the ocean, you know, throughout that whole COVID situation. So there's certain things that I think we're not necessarily thinking about, but once we talk about that, about showing them what kind of inventory we have, showing them the products that are going to be coming in, you know, where are the products right now if we're expecting them within, say, the next 2-3 weeks, you know, because you don't want to lose an order, of course, necessarily, but what you want to be able to do is, no, I don't have it right now, but I can get it to you in, you know, the next 2 weeks or something like that. So that really helped a lot. And it takes a lot of the mystery away too, because then they're like a part of the whole situation. You know, every week they know exactly what's coming in, when it'll be here, and what our inventory levels are. So it helps keep them, you know, focused.
And in the beginning for us, Hannah, it was, I'll be honest, cheap and easy. If I'm on Microsoft Teams and I get a hold of somebody and they immediately respond, and I see their productivity on the dashboard is doing okay, then that's my cheap and easy way of measuring productivity. Is my DSO going down? Is my error rate going down? Is my bad debt in check? Things like that they have a part of. The initial positions we hired for was prior authorizations and CMNs. So where's my held sales? It went from 15% to 4% within a 2-month period. I know they're working at that point, but getting them on instant message, we use Microsoft Teams, and seeing that they're green, they're active, sure, they can fool the system, but if I ask them a question or if I need to get a hold of them and they respond right away and they get me answers, that was an easy way of managing productivity at that point, because I knew they were working, and it played out on the dashboard and scorecard when we looked at that they were in fact productive.
And then you see it in the overall company numbers too.
Absolutely.
Yeah.
So there's more complex way of handling that, obviously, but for an independent business, that was the easy way of handling it to make sure that they were doing their job.
That's great. I want to make sure to push the results of this poll so we don't forget and leave people hanging, because we did for a minute there and look at these answers here about managing performance issues. It sounds like 43% say daily that they're managing performance issues. 57% say weekly. Nobody says rarely. It's constant. It becomes the job, I think, in a lot of cases beyond the daily tasks that actually have to get accomplished.
Yep.
That's interesting.
It is.
And I guess, John, at least for you all, has working with the the TBO folks helped reduce that somewhat? I mean, you find that they're eager workers in general, right?
I'd say I'd say to improve that dramatically. We would, like I say, we would hire somebody from a local temp agency, that would, in the past anyway, lead to full-time employment, but we could evaluate them. And what we were getting was people that just would show up late, didn't show up. Oh, I can't do this. I'm done now. Work for 3 or 4 days and then quit. Those kinds of things. It was extremely frustrating. So, I mean, Todd came to us at the right time, quite frankly, because, we were experiencing that. And as I mentioned, we had 2 people leave, various reasons, but, the door was wide open because we needed to make some sort of change that was going to stick and not have to monitor it all the time. When I see this weekly thing of 57%, that's a big chunk out of a person's time, to handle that, daily 42.9. I don't know. Those are big numbers. And I think what's happened to us is because we've kept communication open, we have those weekly meetings, anybody has a problem, whatever. We're even getting people, we're getting some of our people over in the Philippines who are actually putting programs together to help assist in our KPIs because they're proud of what they're doing. I think it's incredible. But that's the kind of thing that I think if you incorporate those kinds of ideas, include those people in any kind of communication you have, treat them as your own, direct employee, I think you're going to be very, very impressed.
Is it possible then, if somebody really is not just fulfilling, but sort of exceeding expectations, do some of those team members get promoted or get raises?
Well, funny you should mention that because we had 2 people that I think were actually competing for our favor. Let's put it that way. And so they were doing things like they were, breaking out some products and complementary accessories, things along those lines, where they were monitoring this and they figured that okay, on O2 tank holders as an example, we get a probably 1 in 10 before, and now we're doubling that to say 1 in 20 or 2 in 20, and so they were proud of what they were doing, and I remember getting a couple of phone calls from them saying, "Hey, I'm thinking about this. Would this be helpful to you?" Of course, it would be. We could take a look at some of our customers and what they were doing, some of the questions that they were asking the customer service people that we might have to address with a new product or a new program or something along those lines. So they became part of the overall team, and it was really fun to watch that happen.
So you start a new interesting topic, Hannah, and that is promoting the individuals. And we don't dictate those rules. We follow the lead of our clients, but we have a plethora of clients that after tenure is gained, they start to see which ones are the rock stars or the ones that yes, they know are going to want to stay long term. And we have a tier that they can follow, that clients can follow, that says give them a promotion. And in fact, we actually do have some clients that as time progresses, they've got the proof of concept of the 1 or 2 people, they add 3 to 5 or 6 or 10 or whatever the number is. They decide, well, let's have one of them be a leader, let's have them be a supervisor or a manager, and they can help manage some of those productivity concerns or gaps or knowledge areas of concern, or all those types of things. And yes, we have seen high success with that.
That's fantastic. Or maybe do that last 20% of the training to your organization. That's
absolutely
interesting.
Absolutely.
That's great. And I know, Todd, you've said that you've come to rely on some particular individuals really at a very high level, right?
Oh, absolutely. We have executive directors that are part of our organization now that are within the TBO umbrella, if you will, and they've proven themselves time and again. We've got some pretty smart people that are educating me on how to formulate our leadership and the technology supportive of that. In fact, much to what John was just saying, they're coming to me now with ideas of how we can further TBO and our product offering out there, not into a realm outside of what we already do, because we're a staffing agency. At the end of the day, we're providing people with needed staff, and people need that more than anything right now. But to complement that, and that's helped us out quite a bit. So yeah, I rely on them a lot.
That's great. On the opposite end of the spectrum, somebody's asked, do you have to hire for an FTE, or can you hire somebody for, say, 20 hours a week?
So the answer to that is yes and no, and whatever you need. So if you need a full-time person, great. If you need a part-time person, we can handle that. You want to move your part-time person to a full-time person, great. You need a project, you're switching from Brightree to Nico Health, and you need somebody to help with data entry for 2 months, great. We have people for that too. How many do you need? So we try to be real flexible on our client needs.
That's fantastic.
And I would encourage somebody, if you're still in doubt, or your business partner or significant other is saying, well, I don't know, try one. Try one. That's what we did. We started with the first one, and within a month, we were looking for the next one. We were sold. And that's what John did as well. We want you to have somebody who's going to work for you and what you're trying to do. So try that first one, and in a month it's not going to work, send them back. We'll shake hands and remain friends.
Mm-hmm.
That's great. Well, as we get to the last few minutes here, I guess I'll just go around and have each of you ask each of you if there's one thing that you would like people to kind of walk away with in terms of, how this kind of staffing model can really help enable growth for them. What would be that kind of core point that you'd like people to walk away with?
Well, I think just based on what we've done, speaking from personal experience, I've used this to expand our footprint on our other businesses. I've used this to open other businesses because it's worked out so well. And it's allowed us to thrive in an environment that is very tough to even survive in. And that's what I would suggest or leave as a parting thought, is to utilize this type of service, tactical back office, to front your growth, and not only at a reasonable cost, but sustainable and accountable. You can grow your business without having to worry, are they going to show up today? Or am I going to not have personnel today? Are they calling in sick today or anything like that? It's reliable. So that would be my parting thought.
That's great. Who else wants to jump in? Corey?
So, yeah, I mean, to piggyback, I would walk away with emphasizing that everything that we're doing today, we are doing out of necessity for Todd's own businesses. What we're doing today was done because that was the only way to survive. And it's very clear to understand with Medicare Advantage plans and all the other insurances that, we can try to negotiate rates, but the likelihood of rates going up at the same rate or even at all with regard to the cost of living and vendor increases is very unlikely to happen. So we have to find ways to control our costs. This has been invaluable for us as well as hundreds of clients of ours. So I would just strongly encourage you to go considering it. Start with one person, give it a try, get a proof of concept, and I'd be very surprised to hear if you weren't thinking of other things you could use to delegate the work for.
John?
Well, this industry itself is just probably the most complex industry I'm aware of. I've been in it a long time, and I grew up basically in the times when reimbursement was good. Everybody was happy. Everybody was making money. People were getting into the business because of that. And those days have disintegrated over the last several years. So when you hire somebody now that's off the street or from a resume or whatever the case may be, just think about the time it's going to take you to educate that person to your policies and, of course, the Medicare situation, the HIPAA situation, everything else. It's a very highly regulated industry. So if you already have somebody that's hitting the bricks running because they've been trained, it's going to reduce that time to get those people up to speed very dramatically, which is important because your time is important. So that's something that, when we found out that they already went through a bunch of training, that they could hit the bricks running, all it was after that was training them on the product and the customer service department, getting a phone line or a computer line so they could work remotely, and they're up and running. Very simple.
That's fantastic. What comes next, I guess, for TBO specifically, Todd?
Well, we recently launched a sister company, Tactical Call Center, that is a 24-hour contact center for call overflows and after hours, and it is specializing in doing things that the other call centers don't because they're pretty generic. So we'll log into your operating system, we'll talk to clients after hours, we'll manage expectations for what comes in after hours, mainly for on-call. But we're doing that not only for HME, DME, but home care, hospice, and some of the physician groups as well. And then we're looking at other opportunities of what our clients need. We're always listening to our clients, and everybody says that, but man, it's been true for us where they're giving us ideas of what kind of personnel they need. And if we can find that person, we're going to get them trained up and placed. And that, I think, has been continual growth for us.
That's fantastic. Well, thank you all for joining us. This has been so informative. For those who are attending, you will get a recording of this conversation, so just keep an eye out for that. And I want to thank John and Corey and Todd for taking this time with us. We really appreciate it.
Thank you very much.
Thank you.
Thank you. Thank you, Hannah.
Thanks, you all.